Well, thank you, Dr. Stallings, and thanks to the committee members for volunteering their time. You don't get a flak jacket even though you need one. So what I'd like to do in just a few minutes is go through, okay, not advancing. I think we're going to have to do this from the back of the room. I'd like to just spend a minute on how we got here. The federal sponsors from both the U.S. and Canadian governments have been working towards this for multiple years. And you can see here that we actually started planning this 6 years ago in 2012. We had an open nomination period in 2013 where anyone, federal agencies, private individuals, food industry, academics, could submit a nomination for their favorite nutrient to get re-reviewed. And we received 26 nominations. They were sort of condensed into about a dozen classes or categories of nutrients that were actually evaluated. And we created working groups of federal employees who not only evaluated anonymized nominations, but did our own literature searches on those nutrients. So there was a very extensive time spent on this. One of the points that we decided up front was that we would have a systematic literature review done independently of both the government and the National Academy of Sciences. And so we went to the Agency for Healthcare Research and Quality, and they just yesterday posted for public comment the final version of their review of sodium and potassium, absolutely just in time, as Dr. Stallings has pointed out. Sorry, it was truly like giving birth to an elephant to have this done. And we've been back and forth with them multiple times to try to clear up some discrepancies in the report. So we hope the final version actually is good, but it is open for public comment and certainly for review by the committee at this point. One of the things that visitors should understand is the National Academy does not make the decision to re-review a nutrient. That's up to the federal governments to give a contract to the Academy to do that. So it's a federal decision from both governments. Let's see if this, it works, fantastic. So one of the things we didn't consider in our multi-year planning process was the U.S. Congress. And there's been congressional language which certainly affects all of the U.S. federal agencies, not so much the Canadian agencies. And there's been language in the last 3 budget years for us to pay attention to various nutrients that Congress has called out. And sodium, in fact, was called out in the 2016 and 17 budgets, preventing USDA from changing the salt content of school lunches, preventing CDC from doing any sodium reduction activities until values were re-reviewed. So that's basically how we got here. Sodium wasn't necessarily our first choice. Congress made it our first choice. And so what the committee has asked us to do in a few minutes this morning is talk about the uses of the DRIs by our various agencies. And so USDA is a very large agency of 100,000 employees, and I want to talk just about a couple of mission areas in the agency. So the Food and Nutrition Service is responsible for the majority of the federal USDA budget. Most of it just is handed out to the states. We don't actually implement most of the feeding assistance programs. And so it's 3/4 of the USDA budget being handed out to the states. And the biggest is SNAP, what used to be food stamps. That has no nutritional requirements. So DRIs, in theory, don't affect that. But the WIC program, the Women, Infants, Children program, does meet nutritional standards. That is significantly impacted by DRIs. The school meals programs, lunch primarily, breakfast, also represents about 50% of the number of meals that school lunch does. So it's quite substantial. And one of the points is that half of infants born in the United States participate in WIC, so it's very substantial footprint across the country. 30 million school lunches, 15 million school breakfasts every day in this country. And we've had to suspend the sodium reduction activities. It's about a 10% reduction for Target 1, and there were stepwise reductions under the previous administration, which are suspended by the current administration. There are some smaller food programs that also serve meals that do have to meet nutritional standards that USDA pays for. Food and Nutrition Service also runs the Center for Nutrition Policy and Promotion was recently merged under the Food and Nutrition Service by the current administration. That actually just happened in the last month or so. And they put out dietary guidelines for Americans with various HHS agencies, primarily Office of Disease Prevention and Health Promotion. And the dietary guidelines are responsive to the DRIs. They're not going to recommend a diet that doesn't meet all the DRIs. And of course, the food industry responds with reformulations. That's probably the biggest effect of DRIs and the dietary guidelines. FNS also puts out My Plate, which is the educational aspect. And the My Plate logo is simply that it's a logo. It's not the entire educational program. It's important for folks to understand that there's a lot of educational materials that you can find online. I'm in the Agricultural Research Service, which is part of the Research, Education, and Economics mission area. And we do the nutritional part of the NHANES survey that CDC runs. We actually pay for one of the 2 days of interviews, and we analyze all the food intake data and convert it into nutrient data because we also maintain the food composition database for the federal government. So we publish a variety of research and data briefs related to the NHANES survey. The Economic Research Service does a lot of primarily intramural research on food security and the efficacy of many nutrition support programs. They also have a small extramural nutrition grants program where they have people at universities analyzing some of the nutrition assistance programs. And then finally, the extramural funding agency in USDA is NIFA, National Institute of Food and Agriculture, and they have grants for a variety of topics. But the most recent one I could find related to sodium was on bone health, but that was several years back. I think that's my last slide, so it's time for Dr. Hutchinson.